So you've been diagnosed with a corneal abrasion. Here's what you need to know and a bit of what you might like to know. So a corneal abrasion happens when you have a slight scratch to the surface of your eye over the colored part. It can feel very uncomfortable because we have a lot of nerve endings that go to the eyeball, and when you scratch through them, it feels like there's something in there all the time. Your eye's going to go very red and it's going to tear. The good news is that the majority of these, the vast majority, heal within 24 to 48 hours. In fact, you should not have any more pain after 24 to 48 hours. If you do, you need to come back to the emergency room or see your ophthalmologist right away. As far as pain is concerned, you do need to take something for these because it is quite painful. You can start with acetaminophen, which is the same thing as Tylenol, or ibuprofen, which is the same thing as Advil or Motrin. If that's not enough, the emergency physician may have prescribed you something stronger like Tylenol 3s or Percocets. These have stronger pain medication, but they also cause constipation and they do make you sleepy. So do not drive or operate heavy machinery while you're taking Tylenol 3s or Percocets, and take whatever you have in the house for constipation at the same time, like Metamucil or Docusate, whatever you've got in your drug cabinet. That will make sure that you don't have troubles later on because you've been taking these pain medicines. They can be quite effective at nighttime when you can't sleep because of the eye pain. They make you sleepy anyway, so now you can get a good night's sleep, which will make everything seem better in the morning. The two main things to avoid are to get not have worse injury or more injury in this time, and to keep an eye to make sure that there are no complications. Complications that you should return to the emergency room are, first of all, as I said earlier, if it doesn't go away within 24 to 48 hours in terms of pain, if you're still having pain after that, you need to come back. If you develop pus coming out of your eye, if you have worsening of your vision, or if you have increasing eye pain over the next 24 to 48 hours, then you must come back. In the interim, many doctors prescribe an over-the-counter polysporin eye drop, which you can put in to prevent you from getting a bacterial infection. It's actually not necessary. It's a preventative measure to make sure you don't get an infection on top of the scratch, but you don't have to use that. Some basic saline eye drops and some eye ointment at night can be very effective just to keep everything well lubricated. Many patients ask about an eye patch, and we do not do eye patching. By eye patching, I mean one of these pads over the eye and then a piece of tape from the forehead to the cheek. We no longer do that. About 20 years ago we used to patch eyes, but now there's evidence to show that it not only doesn't help, it actually makes healing slower. So no eye patches, just the eye drops and the eye ointment. The saline eye ointment and the saline drops is effective, and if the doctor gave you a prescription for some antibiotic drops, do take those as well. I'm Dr. Atsma, and those are my discharge instructions for a corneal abrasion.